आज चाहिँ Newahs presentation plus English ma bhane mix हैन थो academic platform में जिता थाना पास कुछ अब ठीक थाना invite किया अलग थो opportunity दिया तो present दिया तुलन लोगों से सुबह thank you very much थो presentation में लगी चाहिए जो NHS mental health services 4 years जानो involved with it 3 exclusive case scenarios that present the reason why I've chosen these cases are because they have been quite challenging in the process of assessment and management. In some ways, these cases have improved my own insight into understanding of psychiatry, and it's very pertinent to the current mental health scenario and illnesses at the moment. So, without any further delay, there's quite a long list of the stats in there, but what I want to concentrate on is very crucial things. Actually, so how common is mental health problem? Understand is 1 in 4 people, adult, will experience a mental health problem, and children, there's 1 in 10 children aged between 5 and 16 years can experience mental health problem. It's very, very common. So almost half of adults will experience an episode of depression in their lifetime. So, mental health problem can be an elephant in a room. We don't talk about it. There's still a lot of stigma attached to it. In the recent years, awareness has increased. People are talking about it. Lots of campaigns are going around. People understandings are improving. What gets forgotten when we think of mental health patients is the physical health side of things. I've given one example here on the slide as well. People with schizophrenia, I'll talk about schizophrenia in a second in my next slide. People with schizophrenia are almost twice as likely to die from heart disease and 4 times more likely to die from respiratory disease than the general public. So sometimes it's forgotten, like psychiatrists, they're doctors dealing with mental health problems, but it's equally important to understand that they also have a responsibility to look after patients holistically, also looking at their physical health problems as well. The scenario is a straight one. But this is an introduction. So what is psychiatry? What are the skills required? What is that? Psychiatry is a medical field concerned with diagnosis, treatment, and prevention of mental health conditions. There are quite a few lists of things that a psychiatrist has to acquire in the process of training to become a psychiatrist. What I want to focus is on the biopsychosocial model of understanding. Biopsychosocial, as the name says itself, a biological aspect is not a body. So body, not a brain. So how does the cause of illness stem from functioning of brain? So your brain ego chemicals do. Our chemicals imbalance your body, the structure of brain. Skill man as a psychiatrist. Psychological side, as the name says itself, so thoughts. What are your bichar? Your thoughts, thought process. Your feelings, and the way we interact with people in our day-to-day life. So the behavior side of things. That's psychological bit. And social is, as the name says again, it's sort of your social background, economical status, religion, culture, family, friends, all those side of things. So as a psychiatrist, you'll be looking at a more holistic approach in treating a patient. That's why multidisciplinary team approach is crucial in every aspect of looking at the patient's treatment. Schizophrenia. You could media and many people have a perception that schizophrenia is split personality, that is not true. Definition on simplistic way not what is schizophrenia? And the sufferer of schizophrenia, there is a total breakdown in the person, in the sufferer's sense of making a coherent sense of the world around him. So the thoughts, feelings, and perception becomes distorted. So this person starts to have symptoms like hearing things that are not there, seeing things that are not there, which we call as hallucinations, and believing things that are not true, which we call as delusions. So there can be various types of delusions, but I want to give you one example of a delusion of this particular patient I came across in a secure forensic psychiatric unit. Forensic psychiatric unit, just to tell you a little bit about what that is, it is a specialized unit for people who have mental health problems alongside having been arrested for a criminal act or been in remand or been to court and things like that. So but they do have mental health needs. So this gentleman who I came across in the forensic unit had a long-standing history of schizophrenia. So gentleman said to Rasani, Quran no bunyu, Bible no bunyu, or ekdamai delusional grandiose ideas is Jesus thayo, goble Allah thayo. We believe that. Analipa चाहिँ जसकै challenging we say symptoms Rasani sexual disinhibition laga चाहिँ एकदम sexually inappropriate behavior. So aji chuja consultation when ले चाहिँ inappropriate words the use याव, hand gestures the use याव. उकी यहाँ चाहिँ especially female staff नाम engage याद चाहिँ एकदमै challenging to लगा था particular patient. उकी माथि चाहिँ we एकदमै violence, एकदमै aggressive behavior. Now at this point I want to make a little point on the misperception of violence in mental health patients. People think that mental health patients are violent, which is again not true. The reality is, people with mental health problems, they are more likely to use drugs and alcohol. And drugs and alcohol sparks violence rather than mental health problems per se. So his violence was secondary to his mental health problems. And one scenario, or personal interaction with him, was, just to give you an example of his violent behavior. I was in a seclusion review for this particular gentleman. Now, seclusion room is a padded room where patients are, well, mostly agitated and aggressive patients are confined. It's almost like a control tactic for patients to calm them down, almost like de-escalation, so there's no stimulation around, and things like that. So basically, as a protocol, psychiatrists go in and review them every 4 hours. So in one of those reviews, when I went in, with a clear thought in my mind, that I would be prescribing him medication. So as soon as I entered, he obviously felt persecuted by me. He felt that I was going to poison him as a part of his delusional beliefs. So you don't start saying, on a nurse's today, I was a brownie with the GM. Down is at want you to knock on him, I was aware of that. And he, all of a sudden, lunged at me. So he was very loosely restrained by nurses. So he lunged at me, and with a view to maybe not attack me, but to run away from the unit, so abscond from the unit. Luckily, obviously, the nurses are trained with violence and aggression techniques, so they were able to restrain him, and nothing happened. But anyway, this process went on quite a few times in the following months. However, the good side is we were able to administer medication against his will, and he did improve. Therefore, there was improvement in his mental state, level of arousal, and he stepped down into rehabilitation ward, which is a sign of great improvement. So that's my first scenario. Now, eating disorder. Appearance is very crucial these days for everybody, but especially for young generation. And eating disorder have gained a lot of popularity in recent years, and a lot of professional attention as well, because of the cultural norm of idealizing thinness. And there are a number of magazines that publish articles on losing weight, strategies for losing weight, and loads of young generation want to look like these lovely girls, these gorgeous girls on the slide. So eating disorder, what is eating disorder? So it is actually characterized by body image, distorted body image in a person, especially adolescent, more common in girls, 10 times more likely than in a man, in a boy. They have intense preoccupation with weight and intense fear of gaining weight. So when they look at themselves in the mirror, they actually see a bigger size of them, despite them being quite low. In fact, quite seriously low in their body weight. So eventually, if they're not treated, they can be potentially fatal because it starts to affect their physical health, their heart, and important organs in the body. I can give you an example of this 16-year-old girl. She was aspiring to become an actress. She was living in a household where the family dynamics was very difficult. So that was mostly a way, very critical of her. Although she was achieving very well in school, parents especially criticized her and wanted more of her. There were high achievers in the family and they had more expectations of her. So she felt very pressurized in the family household. She presented with restricting her food intake. She was not happy with the way she looked. And she used various ways to keep her weight down. I've put down a few examples there. You can see she was counting her calories, she knew exactly how much she was eating, excessive exercising, smoking, chewing gums, and things like that. It's a challenge to get to the last thing. They, or especially people with eating disorder, they're expert in concealing, so they will do whatever it takes to keep or not to let people know that they're losing weight. A challenge is to the last thing. Let's say outpatient clinic wave water load in a way, don't load on our way. Let's say pocket apa no gonna subscribe weight of pocket. One of zoology completely vigilant just in the mouse. Consistently how weight as gauge on reaction weight. Okay, Martha said she is an expert, so she can quite easily trick her parents. Meal time, dinner time, parents instruct khana debut time laga pocketed khana suskew. Toasted butter